Is the future of medicine not even seeing a doctor? That future is here now in California. Let's find out what's happening. Medical startup uses LLMs to run appointments and make diagnoses, and thanks to MIT Technology Review for this one. Imagine this. You've been feeling unwell, so you call your doctor's office to make an appointment. To your surprise, they schedule you in for the next day. At the appointment, you aren't rushed through describing your health concerns. Instead, you have a full half hour to share your symptoms and worries and the exhaustive details of your health history with someone who listens attentively and asks thoughtful follow-up questions. You leave with a diagnosis, a treatment plan, and the sense that for once, you've been able to discuss your health with the care that it merits. The catch? You might not have spoken to a doctor or other licensed medical practitioner at all. This is the new reality for patients at a small number of clinics in Southern California that are run by the medical startup Akido Labs. These patients, some of whom are on Medicaid, a privilege typically only afforded to the wealthy few who patronize concierge clinics. And I can tell you personally, often I usually wait months for a specialist appointment. So next day, pretty darn good. The key difference is that Akido patients spend relatively little time or even no time at all with their doctor. Instead, they see a medical assistant who can lend a sympathetic ear but has limited medical training. The job of formulating diagnoses and concocting a treatment plan is done by a proprietary LLM. The system is called ScopeAI, and it transcribes and analyzes the dialogue between the patient and the assistant. A doctor then approves or corrects the AI system's recommendations. Our focus is really on what we can do to pull the doctor out of the visit, says Jared Goodner, Akido CTO. We're going to find out why they're taking that approach in a minute, and there's a very good reason for it. According to Prashant Samant, Akido CEO, this approach allows doctors to see 4 to 5 times as many patients as they could previously. There's a good reason to want doctors to be more productive, and here we go. Americans are getting older and sicker. It's all over the place about the epidemics of heart problems, diabetes especially, etc. The pending 15% reduction in federal funding for Medicaid will only make the situation worse. Again, this is not a political channel. I'm relaying the article to you. But experts aren't convinced that displacing so much of the cognitive work of medicine onto AI is the right way to remedy the doctor shortage. The experts say there's a big gap in expertise between doctors and AI-enhanced medical assistants, says Emma Pearson, a computer scientist at Berkeley, to which I personally would add, for now, it's clear that algorithms improve exponentially on more and more data, which is constantly being generated in this environment. AI is already everywhere in medicine. Computer vision tools identify cancers during preventive scans. Automated research systems allow doctors to sort through medical literature quickly, and LLM-powered scribes take the appointment notes. But these systems are designed to support doctors as they go about their typical medical routines. Now, what they don't talk about in this article is robotics. Robotics are stepping in and doing surgeries completely with a doctor monitoring them. What distinguishes ScopeAI is its ability to independently complete the cognitive tasks that constitute a medical visit. So how does this work exactly? Under the hood, ScopeAI is a set of large language models, each of which can perform a specific step in the visit. And many solutions tailored to a specific industry are being constructed this way. Different LLMs for each task. It's mixture of experts. We've talked about that. For the most part, these LLMs are fine-tuned versions of Meta's open access Llama models, though Goodner says that the system also uses Anthropic's Claude models. And that's another thing that's happening now. Different LLM makers are being used for different tasks within a single solution based on their expertise in that particular task. That method, by the way, may be the path to AGI. During the appointment, assistants read off questions from the ScopeAI interface, and ScopeAI produces new questions that it analyzes what the patient says. For doctors who will review its outputs later, ScopeAI produces a concise note that includes a summary of the patient's visits, the most likely diagnosis, 2 or 3 alternative diagnoses, prescriptions. It also lists a justification. For each diagnosis and recommendation. That's obviously important, particularly in healthcare. So ScopeAI is currently being used in cardiology, endocrinology, and primary care clinics, and by Akido's street medicine team, which serves the Los Angeles homeless population, which is huge because it's warm there year-round. This includes treatment for substance use disorders for the homeless. So this is opening access to medical care for people who basically otherwise don't have it. Since they started using ScopeAI, the street team has been able to get patients access to medications to help treat their substance use within 24 hours, something that Hockman calls unheard of. And Hockman is the head of the street team medical team. While Medicaid allows doctors to approve ScopeAI prescriptions and treatment plans offline, meaning not in the appointment itself, both for street medicine and clinical visits, many other insurance providers require that doctors speak directly with patients before approving AI-driven recommendations. So that may be prudent for now, but as algorithms improve, and we'll see how reliable these are in a second, that may change. For the homeless, being seen quickly by an AI-enhanced medical assistant may be better than dealing with long wait times and limited provider availability, which is the status quo for Medicaid patients, and I think people in general. Like I said, to see a specialist in the area of the country I live in now for the last few years, it's very difficult. Glenn Cohen, a professor at Harvard Law School, says that any AI system that effectively acts as a doctor in a box would likely need to be approved by the FDA and could run afoul of medical licensure laws. Neither the FDA nor the Medical Board of California were able to say whether or not ScopeAI was on solid legal footing based only on a written description of the system. But Samant, the CEO, is confident that Akido is in compliance because the system requires a human doctor to review and approve all of its diagnostic and treatment recommendations. He says it doesn't require FDA approval. Now, as I mentioned, you guys, I am a lawyer, and that sounds like a correct position to me. Patients don't ever see the ScopeAI interface directly. Instead, they speak with the medical assistant. That arrangement might make patients feel more comfortable because all ScopeAI recommendations are reviewed by a doctor. That might not seem like such a big deal. It's the doctor who makes a final diagnosis, not the AI. But it's widely documented that doctors using AI systems tend to go along with the system's recommendations more often than they should, a phenomenon known as automation bias. And that phenomenon, by the way, is pervasive. It's very common in the legal field, with fake cases being cited and the judge calling out lawyers for citing legal cases that don't exist because they just relied on the AI without checking anything. So this is common. An Akido spokesperson says that automation bias is a valid concern for any AI tool that assists a doctor's decision-making, and that the company has made efforts to mitigate that bias. We designed ScopeAI specifically to reduce bias by proactively countering blind spots that can influence medical decisions. And by blind spot, they mean human doctors relying on their experience and intuition a lot versus medical research of factual cases. This is why misdiagnoses occur frequently. We also train physicians explicitly how to use ScopeAI thoughtfully. Akido evaluates ScopeAI's performance by testing it on historical data and monitoring how often doctors correct its recommendations. Those corrections are also used to further train the underlying models. That's reinforcement learning, folks. Before deploying ScopeAI in a given specialty, Akido ensures that suggested diagnoses are accurate at least 92% of the time. I would bet that's already better than humans, but I don't know that. I haven't looked it up. But Akido hasn't undertaken more rigorous testing of its system, such as studies that compare ScopeAI appointments with traditional in-person or telehealth appointments. And they should do that. Making medical care cheaper and more accessible is an important goal, but experts think it's important to conduct strong evaluations comparing system recommendations to the baseline, which is human visits. So this is really a step change in healthcare, and it won't be the last by a long shot. Harvard Healthcare in Boston has been using AI to do medical intake for several years now, so this is going to become pervasive. The fact is that there is an acute doctor shortage now. Why? Because it's brutal to become a doctor, and once you become a doctor, you now have to deal with huge health insurance companies for a significant portion of your time, getting pre-authorizations or appealing claims. And then on top of that, private equity has bought up a majority of medical practices now, and private equity is not user-friendly. How do I know that? I've worked for multiple private equity companies. I know what I'm talking about. So this kind of approach is actually very important. And a final comment is, if you live in a rural area, like presumably many of my viewers do, getting good quality health care is virtually impossible. It has been reported, and I don't know whether this is true or not, but it's been reported that this Medicaid reduction will force hundreds of small hospitals to close, further eliminating rural health care. So this kind of approach needs to be considered. Does it need to be rigorously benchmarked against current practice? Yes, of course it does. All AI needs to be benchmarked to be certain that it's performing correctly and that hallucinations are minimized. But that doesn't mean you shoot the messenger. No, what it means is you roll these new technologies out thoughtfully and carefully, but you do roll them out to improve people's lives and health care. What do you think? Let's have a debate on this. I'd like to hear both sides' opinions, please. Also, please like, subscribe, and share. It's really important for the algorithm. We passed another important threshold recently. 2,500 subscribers puts us in the top 5% of YouTube channels. Thank you so much to my subscribers. This is all happening because of you. And please please support us on Patreon. So we need your support, especially right now, but always through Patreon. $1 a month, $2 a month, $5 a month. It all helps tremendously. Please support us. It's a low amount. It'll really help us grow the channel and bring you resources like doctors are going to need to change careers into something that is relatively AI resistant. Thanks so much. See you next time. Take care.